Now, this is an example I want to give that when you meet someone, your family, friend, people around the street, you see the symptoms, and what they see is tremor, slowness. They see decrease in facial expression. They see your changes in the walking, the slowness in walking. But what they don't see are the other symptoms, which I will be discussing later on, which are very common. So I want to start with the first symptom, and videos speak more words than I can explain to you. So I want to show some examples, and you can see how the symptoms of Parkinson's disease looks like. Of course, you know that because you're living with it. You know people who have Parkinson's disease. But this is something I want to tell you as a Parkinson's specialist to see how we grade you. When I see you in the clinic, I say, okay, the tremor is less, the tremor is more, the tremor is much more. And this is how we look at it as per the international guidelines. The other symptom that people can see, that everyone can see, is a slowness in the body movements. This is, in the clinic, we test by tapping your leg, tapping your hand. This is something that many patients think that I'm doing some exercise with them in the clinic, but this is actually, I'm seeing what is the severity or how much is the slowness of the body is affected with Parkinson's disease. I want to come to a myth that many people say that I don't have a tremor, so I don't have Parkinson's disease. I agree. Parkinson's disease, you see mostly tremor. But again, there is another big group of patients who do not have any tremor, but they have symptoms of slowness, stiffness, difficulty in walking. And that is also Parkinson's disease. I will emphasize by showing the video of these two types of Parkinson's disease. So you can see these are very nice patients who have Parkinson's disease for many years. And we can see that these two patients with the white shirt, you can see that he is having a lot of tremor. The patient in this video, you can see there's significant slowness in the walking. So we are seeing here is patient who has a lot of tremor, patient who has difficulty in walking and slowness in walking. Now coming to the symptoms that people cannot see that you are experiencing, and this is something that when you come to the clinic, I will ask you a set of questions. Our team is specialized in this. We deal with all these things and we try to manage you with all these symptoms to make your quality of life better. Number one, which is IMSAC, constipation. The other symptoms are sleep disturbances. Patients will tell me that at night they have a lot of cramping, a lot of pain in the legs, difficulty in sleeping because of the pain. Also difficulty in moving around, turning over in bed at night because they feel a lot of stiffness and tightness in the muscles. And number three is sometimes the patient's wife or patient's husband, they tell me that at night, doctor, he is talking in his sleep. He would move his arms and legs. He is talking. He would sometimes scream, shout. These all are symptoms of Parkinson's disease.